We all know that as labor progresses, the fetal pH drops. That's true in all mammals. But the question is it actually relevant to outcome? Because it's normal to do that. In the ensuing 70 years, this hope has evolved into theory, the theory into practice, and the practice into a standard of care leading to cesarean delivery out of concern for fetal well-being in approximately half of the more than 1 million women undergoing cesarean delivery in the United States every year. So basically, he's saying half of the cesareans performed in the United States, and there's more than 1 million, it's about 1.3 million, are being done for calling fetal heart rate abnormalities.
Reassuring fetal heart tone.
Correct. This has occurred without any evidence that delivery based on any single or combination of fetal heart rate patterns reduces the rate of cerebral palsy or any other permanent long-term adverse neurological outcome. And by the way, in this article, he cites, got reference after reference after reference. So this is not an opinion piece. The rate of cerebral palsy remains stable, 2 to 3 per thousand births between 1985 and 2010, decades that witnessed both the incorporation of electronic fetal heart rate monitoring into general practice and a dramatic rise in cesarean delivery rates based on such monitoring. He doesn't mince words. He's just saying that the C-section rate rose because of continuous monitoring. Even in low-resource nations in which continuous fetal monitoring and expeditious cesarean delivery are unavailable to most women, rates of cerebral palsy, 2 to 2.8 per thousand births, are virtually identical to those seen in the United States. If C-section or interventions is going to prevent cerebral palsy and you're doing 1/3 of all women are being born by C-section, why haven't we seen at least a third drop in the rate of cerebral palsy? How do we explain the chasm separating basic science theory from clinical reality? Why do we persist in a practice that is not only non-evidence-based, but clearly refuted by the available evidence? Okay, so we can talk a little bit about tracings here, which is sort of what you wanted to talk about today. So briefly, a category 1 fetal heart rate tracing simply indicates that the fetus is, at that particular moment in time, neither hypoxic nor experiencing an arterial pH below 7.15.
Do you want me to maybe do a simpler explanation?
Sure.
Of category 1 and 2? Okay. Category 1, this is normal and does not require intervention.
Okay. What is category 2?
Category 2 is called indeterminate and may require evaluation, monitoring, and possible quote unquote corrective measures, such as position changes, giving IV fluids, giving the mother oxygen, giving drugs to slow down contractions, or putting warm fluids in the uterus.
Okay, right. That may not all be true anymore because they're lumping everything together, as I'm going to describe. They're lumping together all the different things in category 2 tracings. But what's important and what Dr. Clark says is that the human fetus has evolved to tolerate these acidotic changes. Right? What I'm saying is that babies that are chronically stressed, we know will adapt to that stress.